Good afternoon and welcome to Waco City Hall. We're on the third floor in the conference room. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco. I want to welcome you to our weekly press conference where we have five very important people of this community and help get us through this pandemic as we are. Right now, down in our studio, and in the first floor of our studio, we are making a complete Spanish interpretation of this, as well as an American Sign Language interpretation. And as always, so gracious to be a part of our press conference to start it off, we have our City Council member for District 2, Hector Sabito, to speak to our Spanish-speaking audience and invite them to watch today at 4:30, as well as a replay on our internet that's video on demand anytime from 7 o'clock on. Hector, please welcome and invite our Spanish speakers to enjoy this.
Larry, as always, it's a pleasure to be here this afternoon. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again and have a great afternoon.
Thank you, sir. Always appreciate you. Well, we're conducting this press conference virtually again in this room today. There's only three of us. Julia Oliveira from the City Secretary's office is doing all of our Zoom operations, and we have Mark Randolph from a television station sending it down to our studios downstairs. Joining me now on our panel is our Waco Mayor Kyle Deaver, Mclennan County Judge Scott Felton, and Dr. Jackson Griggs from the Family Health Center, and Dr. Brian Becker from Ascension Providence, and Dr. Mark Lyson from Baylor Scott and White. Gentlemen, thank you again for coming and being a part of this. This will probably be a little bit of a shorter conference than we've had. I'm trying to streamline it. We're not getting as many questions from the media per se, but we're going to answer some of those. But we're going to open with opening comments first. Let you all describe anything that you feel like the community should have in their mind. Then I think I've got like 5 or so questions to read. And then we're going to open it. We have 2 media representatives on the line, and then we'll close with the final comments by Judge Felton and the mayor. So let's start with opening comments. We'll go in the order of Dr. Jackson first, followed by Dr. Lyson, then Dr. Becker, Judge Felton, and then the mayor. So we'll start off with Dr. Jackson Griggs from the Waco Family Health Center.
Thank you, Larry, and thank you, Mayor and Judge, for the invitation back. The world has seen 38 million cases of coronavirus to date. In the United States, there have been 7.8 million of those cases and over 216,000 deaths. The United States incidence of new daily cases has been on a steady gradual climb the past 4 weeks. Over the past week, the rate of fatalities has leveled out right about 700, just shy of 700 daily deaths on average in the United States due to COVID-19. Texas numbers, we've seen right about 800,000 cases and 16,622 fatalities due to COVID-19 in our state. In Mclennan County, this is the update as of this afternoon. The total number of confirmed cases is 9,187. 556 of those cases are currently active. And as of this afternoon, the health district received notification of 62 new cases of coronavirus. 60 people are currently hospitalized due to COVID-19, and 16 of those 60 are currently needing ventilator support. There have been 2 additional deaths in our community due to COVID-19, bringing the sum of total deaths to 131 to date. There have been 83,545 total tests performed within Mclennan County and 71,000 of those have been performed on Mclennan County residents. Within elder care facilities, there are currently 9 facility outbreaks. There are 21 active cases in those 9 facilities. The county jail, there are currently 4 active cases. There are no new church clusters that have been identified within Mclennan County. There are 9 independent school districts and 2 private schools that are reporting cases on campus. And within schools, there are a total of 72 active cases. 52 of those 72 are students, and the remaining 20 are staff members. I'm going to shift now to share with you my slides, as I've done previously, just to give a graphic representation of where we are as a community. What you'll see here is the new cases per day, per 100,000 population. And I'll start by showing the number of new cases per day per 100,000 in population for the United States. I'd mentioned a steady gradual rise in cases. You can see here starting around middle of September, that gradual increase in new cases in the United States. The orange line here represents number of new cases per day per 100,000 in Texas. And you see that Texas has been on a steady decline since really since the peak in late July. But recently, we've seen a little uptick here in early October in new cases per day per 100,000 in Texas. Now, Mclennan County new cases, I would point out that we have there's a lot of the majority of the period of time since early June, we have exceeded both the state and the country's numbers of new cases per day. And what you'll see here starting in really early September is a kind of upward trend. And this is concerning because we're worried that we might hit that threshold, that tipping point, where we could see exponential spread in the community. So just as a reminder, we're using Harvard's Global Health Institute thresholds. And what you'll see here is that between 1 new case per day per 100,000 and 10 new cases per day per 100,000 on rolling average is designated as community spread. Accelerated spread is 10 to 25 new cases per day on rolling average. And then at that 25 new cases per day, that's where we really run a high risk of hitting that threshold of exponential spread, that tipping point. So it makes that, that line that I showed you before here concerning, because again, we don't know exactly for our community where, exactly that line is in reality. This is sort of an estimate of where the tipping point is, but we know that we're getting close. And so as I've shared last week, the free testing that's available to our entire community is so critical right now. Whether or not you're symptomatic, it's important to get tested. We know that asymptomatic spread may account for as high as half of all of the spread of coronavirus. So you may not have symptoms, but you may still be spreading the virus. It's why asymptomatic testing is so very valuable. So please, if you haven't already, go and get tested. This is a reflection of both Texas and Mclennan County positivity rate, number of positive tests over total tests that have been administered. And we've been hovering right around that 8 or 9% positivity rate. over the last couple of weeks. The state has dipped down to 7%. And again, kind of where our thresholds are, we really have to get the positivity rate less than 3% to see suppression. And between 3% and 10%, we stand a chance of mitigation or slowing the spread. But we really have to get quite a bit lower if we want to fully suppress the viral spread in our community. Reproduction rate, the RT, we've been sharing from the beginning. This is a reflection of how many people one infected person spreads the germ to. And the RT for Texas is currently 1.05, and Mclennan County 1.08. So it is above that 1.00 threshold that we're trying to keep below. And the RT is determined really virtually exclusively based on our behaviors, our health behaviors. So one question that is circulating is, well, what about the fatalities in our community? What are fatalities doing? And what you see is the same general pattern that I demonstrated in new cases, you see in fatalities with a little bit of lag time. So here you see a spike in fatalities in July, and then beginning to decrease through August. And then you see more recently, September and October, more fatalities, not as high as when we had our spike, but you're seeing a pretty steady level of fatalities in September, October. And so this remains concerning. We still haven't brought our fatality rate down. And then just to kind of further drill down on who is suffering the fatalities in our community, 85% of those who have died of COVID-19 in our community have been older than 60 years of life. In terms of race and ethnicity, 52% who have perished from this disease have been non-Hispanic white, 29% have been Hispanic, 18% have been Black or African American and non-Hispanic. A sobering statistic is that 44% of those who have died have been nursing home residents. And so this is, again, why it's so important that we work hard to keep the number of new cases low in our community so that we don't bring that virus into the nursing homes. Here's where, now this is not fatalities, this is cases. So these are, where have the cases occurred along an age distribution? And what you see here is that really the majority of cases have been in young adults to middle age. But again, where those fatalities are in those who are 60 and older. 85% are here in the 60-year-old and older range. So as a kind of visual demonstration of what's happening, we're having this kind of reality where we see a lot of cases in young adults, middle age, but then there's spillover of the virus, of those cases into the aging population, those who end up succumbing to the virus because the older population carries more comorbidities, more chronic disease, and because this virus has a tendency to be more fatal in aging adults, even without chronic disease. So what can we do to help decrease the number of cases in this population that is seeing the majority of cases? There was a report that came out in the CDC's publication, Morbidity Mortality Weekly Review, and it was highlighting what some of the contributions to the high case rate in young adults and middle-aged adults. And there are a number of factors. These really stood out to me, misinformation, the perception of safety, and peer pressure. And these lead to a lack of masking, a lack of social distancing, leads to a clustering in indoors, because there's a sense in which these things may not be as important as health officials and our community leaders have been suggesting. And of course, when we have young adults and middle-aged adults who aren't masking, aren't following those health behavior guidelines, again, we see spillover. So from here, I think consistent, good health communication is imperative. The misinformation is going to continue particularly in online and in social media. And so when it comes across, I think those of you who are advocates for good health behaviors, when you hear of it, just speak to it, say, I'm afraid that might not be true. You might even suggest looking at the CDC website when you see misinformation that comes through, or the World Health Organization, or any of a number of other medical school resources that could be very valuable, like the Johns Hopkins website. There's a sense of there's a perception of that this virus isn't going to hurt me because I'm young. I think encouraging empathy, that this isn't just about your health, but it's about community health, is really imperative. And then I think role modeling is just so key to counter the effect of peer pressure. And so it falls on all of us to demonstrate good health behaviors. I also want to conclude my comments with a kind of in memoriam. Unrelated to COVID, I'm just going to take a moment to speak to the death of Dr. Speckmeyer. Dr. Speckmeyer was a family physician who practiced in our community for lots and lots of years. He was beloved to the entire medical community. He was a physician of tremendous character. He won the medical community's highest award for integrity and character in 2016, the Gold-Headed Cane Award. He was past board member of one of our boards, the Mclennan County Medical Education and Research Foundation Board, the board that oversees the residency program in family medicine and our fellowships. He's been a leader among physicians and a hugely generous soul, and a man who is a friend to all who knew him. And so our deep sympathies go out to the Speckmeyer family, and our prayers are with you. And that's all I have.
Thank you, Dr. Griggs. Now let's move to Dr. Mark Lyson from Baylor Scott and White Hillcrest. Dr. Lyson.
Good afternoon. Thanks for having me back. Just a few comments related to COVID and some encouraging words and some sobering words. So Dr. Griggs has related some of those statistics, and I'll repeat just a few of those that I think are rather telling and ominous. We've exceeded the 1 million mark of deaths in the world. And in the United States, we now have more than 216 deaths. And in our community, we're now at 131 deaths, with a total of over 9,000 cases. That puts our mortality rate at about 1.4%. And we focused a lot on mortality because mortality is final. We can't bring those people back. We can't make them better. We can't see those people again. And so, yes, there should be emphasis on mortality, but mortality is not the only piece that really matters. And we've seen some of those numbers, and unfortunately, we have to take care of some of those patients or victims of this disease in the hospital. And there is tremendous morbidity because of this disease. And so, just because you're young and you're healthy doesn't mean you're immune. It doesn't mean you can't be severely affected by the disease. I can think of many cases of patients who were in their 30s, 40s, and 50s who had no medical problems and had long, arduous hospital stays and protracted recoveries. And in some cases, some ravaging side effects from the disease. One patient comes to mind in particular who was in his 50s and had no medical problems whatsoever before he contracted COVID, and now has a permanent disability and will never walk again, and be able to do the things that he once did. And so this is a terrible disease. And while those patients who do have obesity and diabetes and chronic kidney disease are at higher risk, we're all at risk. And particularly those that we love, and even though we may escape the disease or have a mild case, we can still transmit it to other people. And the scary part is, just to remind people, is that you are contagious before you actually know that you have the disease. And so to say, well, I feel fine and therefore I don't need to socially distance or I don't need to wear a mask is inadequate and inappropriate. And so we are asking people to make this sacrifice of social distancing and masking and reducing the size of your groups and those sorts of things. And we're making great sacrifices in other areas. We're asking people to do that for a reason. And that's until we have a sustainable cure or a vaccine for this disease and we can show that it works and reduce mortality and morbidity in our community. Also, sobering statistics, Italy and France this past week had records for new cases per day since the disease hit their countries back in April. So we tend to follow what Europe is doing, and so they're just a little bit ahead of us. So if we're not careful, we will begin seeing big record numbers like them as well. So again, please be cautious, please be community-minded, and be safe. Thank you.
Thank you, Dr. Lyson. Now let's go now to Dr. Brian Becker, who's the Chief Medical Officer for Ascension Providence. Dr. Becker.
Thank you, Larry. Thank you, Judge and Mayor. I appreciate the invite again this week. Again, I sit as a representative for Ascension Providence and try to speak to the status of things across our organization and our hospital. And I feel that there's a great deal of consistency between the two hospital systems here in Waco. So when I speak to the things I know here, I believe them to be pretty similar across town as well. We continue to have available beds here at the hospital. We are required to maintain a capacity to manage COVID patients. And we, both of our facilities, continue to monitor and track that daily. Over the past week, we've had on average about 32 inpatient COVID patients a day, with about a third of those being in the ICU. And I think that's probably a fairly consistent mix. While the numbers may be a bit different across hospitals, about 1/3, 2/3 ICU to a medical surgical bed is probably pretty consistent. As I said, we have maintained a capacity to treat COVID-19 across the organization. And with that, we have been able to continue to perform surgeries. So we don't have any restrictions placed on the things that we can do surgically here at the hospital. Emergency room visits from the beginning of this pandemic have dropped off drastically. And over the last months, we've seen a pretty slow but steady increase in those emergency room visits. And we're back at around 80% of pre-COVID volumes of folks coming into our emergency room. Most of that reduction in volume is really in those patients who would come to the emergency room with minimal complaints or minor issues. Those are probably still the majority of folks who are just avoiding the emergency room. Those with pretty significant illnesses have started returning to the emergency room, which is good to see. And then I'll just speak to a concern that most people continue to have, which is it safe to go seek medical care? Is it okay to go to the doctor's office? Is it okay to go to the hospital? And again, I can speak clearly for our organization, but I'm positive the same things are happening across almost all hospital systems. And that is really a concerted effort to ensure it's a safe environment for patients to come. We have limited visitor policy, so patients can have visitors, but it's not doors wide open as it used to be. We are screening everybody that enters, every visitor, every associate or employee, every physician that enters the facility is screened at the door to ensure that they don't have any symptoms consistent with an infection and they don't have a fever. Again, a great deal of effort, concerted effort to make sure that the environment is as safe as possible for those who need to come here and seek care. I would tell you again that I think people are growing weary and tired and are frustrated with the constraints that are being placed upon them. But it is, as has been said a number of times already, vitally important for our community that we role model, as Jackson said, this behavior. So we should wear a mask. We should avoid large gatherings. We should stay home if we don't feel well. Practice hand hygiene. All critically important for us. As you look at the graphs that Dr. Griggs displayed, we are lagging behind other communities in our ability to get out in front of this. And it is impacting our loved ones, our community members, those who work in healthcare, whether they're first responders or whether they work in a healthcare facility. It's impacting all of those folks, and we can do better. So I would continue to encourage folks to try their best to mirror those behaviors. Thank you.
Thank you, Dr. Becker. Mclennan County Judge Scott Felton. Judge?
Good afternoon. Glad to be with everyone today. Just so we don't ever lose sight from it, the pandemic, besides the transmission of disease, there's other issues that always come up, and there's consequences to everything that we try to do to prevent it and to stop it that happen too. And one of the issues that we've got here at the county, we've got a large workforce, right at 1,000 people. And of course, many of these are young parents that are dealing with trying to manage the school children that they have that from time to time have to come back home. And so we're dealing with a lot of issues that have to do with paid time off, all those things, family medical leaves and all, and we're trying to adjust those to make sure we treat all of our employees fairly. There's also those older employees that are part of the support group to families that have to take a part in that as well. And so we're seeing a lot of that, just like many businesses are in the community. Also, the other thing that we've seen a increase in activity is the number of mental health patients that we have that we're dealing with through all the different facilities, and not including but not limited to the Mclennan County Jail as well. And so, those are things that we have to add more support around in our community. And mental health is a big issue in this community anyway. We want to be leaders in how we handle mental health issues, and we can't just rely totally on medical people. It's got to be private sector and public health as well to do that. But we've got to move much faster than we thought we were going to have to move. And so, those are things that we're looking at in the community as well. The mayor will talk about community testing and the big effort around that, I'm sure, in his presentation. But it is important that we not only participate in that, but also encourage our employees to do the same, and our friends and others. It can shortcut the consequences of being positive or asymptomatic, where you really don't know you're sick until you get a positive test and you're going to your grandparents' house or other places that could cause the spread. So this would be a good way to cut it off at the pass. So I'd ask everyone to really consider doing that. One of the criteria that we look at is that pertains to a lot of the orders that are out there now, is a percentage of COVID positive patients to the total beds in the hospitals, and we have to stay below 15%. As many of you recall, last week we were coming off of that, where we had hit 15%, and therefore it caused restaurants in places of business to ratchet back from 75% occupancy to 50%. I think one of the questions will be about that after a while, but we now are back out of that restriction. So Many of you may recall when this first started, a lot of the orders that came down into the community that affected individuals and businesses were orders primarily from the governor. And it's swapped back and forth from time to time. One of those were to close bars in the community, but allowed restaurants to stay open under certain criteria and protocols, which seemed to be working pretty well. But it primarily has to do with setting up your business where people have the opportunity to social distance, and also I don't think I've been into any business, whether it's a restaurant or CPA's office, whatever, and has a sign on the door, you need to put a mask on going in. And so it's becoming more commonplace, and that we're asking people to do that, and they're now doing it. Last week, the governor asked for the county judges to reconsider the position on bars. What I've learned is that many of these bars have reclassified under the TBAC, their regulatory authority, to serve food, so they can have the opportunity to use the protocols that restaurants have and stay open. There's a handful, and I don't know the exact number, but I know it's a much reduced number of bars that just had to close down. And so I feel fairly confident most of the patrons of those particular bars have transferred over to the restaurant side, and the restaurants that serve alcoholic beverages and food as well. So, and we did listen to medical advice from Dr. Werner, who suggested that possibly we not do that. There are some numbers that are showing indication, and Jackson showed a while ago some that are concerning. But we think that, and I guess it's on me, is I think that people or entities ought to have the opportunity to try and work towards under some protocols to show that they can operate safely in that regard. Private business has the right to compete, and they do need to follow the rules. If we see that that's not happening, then the county judge has the authority to reverse that order. So, I'm always open for suggestions, and I'll always talk to anybody about that and how it's going, and want to monitor that. And so we're looking for people to do the right thing. And what I've said many times, it's really it's individual responsibility. And so if you don't feel safe going into a bar or a restaurant or other type of business, do not go. It's your responsibility. You know what you have to do to protect yourself and protect others. And if we do that, we would not have to have government line out protocols for us to do things, in my opinion. But as I say, I'm always open to debate that or talk about it in any format anybody wants to talk about. Thank you.
Thank you, Judge Felton. Welcome, Mayor Kyle Deaver. Mayor Deaver?
Thank you, Larry. Good afternoon, everyone. Thank you for joining us. And thanks to all of you who are doing your best to help us slow the spread of coronavirus in Waco and Central Texas. I also want to thank the healthcare workers and first responders who are on the front lines fighting the pandemic. Let me start by showing you some additional graphics related to our community's response to the pandemic. A lot of these numbers have already been discussed, so I'll move pretty quickly through these. The first slide just shows our cumulative cases since June. Our new cases continue to rise every day, and we passed 9,000 total cases on Monday. Next slide, please, Julie. We've been averaging between 50 and 60 new cases per day for the last 4 weeks. As of yesterday, though, our 7-day average was 65 new cases per day. This is just simply too many new cases each day for a community our size. It indicates we still have accelerated community spread in Waco and Mclennan County, We simply must be more vigilant to suppress the spread of the virus. Next slide, please, Julie. Baylor continues to do a good job managing the spread of the coronavirus on its campus. They had been averaging less than 10 new cases per day for the previous 3 weeks. They had a little bump up this past week, which was primarily in their athletic department with athletes and staff. And their 7-day average of new cases is now a little over 12. They also had a small outbreak in one of the dorms, and we were told today that that has gotten under control and they only have 2 active cases there now. So the administration is reacting quickly and taking appropriate measures to control the spread. We really appreciate the work that they're doing out there. Next slide, please. This shows our total hospitalizations and use of ventilators, the blue line being total hospitalizations and the red line being use of ventilators. It's been a little erratic over the past week. But yesterday we had 62 hospitalized patients with COVID-19. That marks the first time we've had over 60 hospitalized patients since the 3rd week in August. And 16 of those patients, again, are on ventilators. Next slide. Dr. Griggs showed this slide. 7 more Mclennan County residents lost their lives this week to COVID-19. This is down from 11 fatalities the week before. In all, we have lost 131 of our friends and neighbors here in Waco and Mclennan County to the disease. And that's all the slides now. Now I'd like to talk about the free public testing that is being offered right now in our community. There are currently 4 primary sites: Waco ISD Stadium at New Road in Bagby, the MCC parking lot on 19th Street, the Waco Convention Center on the Franklin Avenue side, and the Syntex Hispanic Chamber on LaSalle. We also plan to add sites at Antioch Community Church on Waco Drive and Sacred Heart Catholic Church on Bagby at 26th Street. And then we will be adding additional sites as this test moves forward. I simply can't overemphasize the importance to all of us of going out and getting tested. We still have accelerated community spread in Waco and Mclennan County. As Dr. Griggs said, we may be nearing the tipping point again. This is largely because, as we've discussed, the virus can be spread by people who don't know they are sick. They may be in the period before they begin experiencing symptoms, or they may be among those who never develop symptoms. It's up to us, all of us, to take necessary actions to bring our numbers down. What we are trying to do is keep as many people as possible from getting this virus before there is a safe and effective vaccine, or at least better therapeutic drugs available. This will lower the number of people in our community who become seriously ill, have lifelong or long-term complications, or potentially die from this disease. The main things we can do are the things that we've been talking about all along. Stay at home as much as possible, physically distant from others who don't live in your household, and wear a mask when you're in public, especially in a crowded environment. And we can get tested. If I'm currently infected with the coronavirus, even if I don't have symptoms, I want to know it so I can avoid spreading it to my family and others. That is what this testing is all about. It is free to the public. It is quick. You don't have to have symptoms. Just go to covidwaco.com to see the dates and locations and register to take a test. If you don't have a computer or a device that has access to the internet, just go to a testing site. They will help you register there. And we have Spanish-speaking personnel at every site. My wife, Diane, and I went yesterday to the site at MCC and got tested. The staff that were working the site were extremely friendly and helpful. They check you in, they give you your testing swab, and then they help you test yourself. The nurse stands outside the car and gives you instructions on how to use the swab, and she watches to be sure you're doing it correctly. Then you put the swab in the vial, break it off, seal it, and put it in a plastic bag. Personnel then takes that bag and sends it to the lab for processing. It took us less than 10 minutes for both of us to get tested, and you can expect to get your results back in 3 to 5 days. For so long, like most communities across the United States, we did not have adequate testing in our community. Right now, we have abundant testing available, and we should take advantage of it. If we don't take advantage of it, we will be wasting a golden opportunity. But if we do take advantage of it, we will bring down the number of new cases we are seeing each day, and we will save lives. I appreciate Dr. Lyson sharing some of the cases he has seen, some of the difficult outcomes that he has his patients experience, including disabilities that will follow patients for the rest of their lives. The point of this is not to scare you, but it's just to help you understand the seriousness of this disease so that you can understand how important it is to take the appropriate safety measures for you and for our community. Please get tested. Please encourage your family and friends and coworkers to get tested. Thank you. That's all I have for now.
Okay. I have a few questions here I'll pose, and you all can provide answers. And the first one, Judge Felton, is just like you indicated right off the bat. How close is Mclennan County to going over the 15% hospitalization rate?
Okay, thank you for the question. One thing that's changed is initially it was the amount of COVID patients relative to the total patients in the hospital, and now it's relative to the beds available, which is going to cause our number to be slightly lower than it was before. But just looking at over the last week, the highest we've hit was 9.5, which was today, and the lowest was 7.13. So we're quite a bit lower, but I do see that the trend is moving up a little bit.
Okay. How frustrating is it as a health professional for people to ask you for your expert opinion on COVID-19 only to have them ignore it, from the president down to the average person?
Dr. Becker, would you mind speaking to that?
Sure. It is frustrating, but it's frustrating in the same sense as it is if you have kiddos. I have 4 children, and you can grow frustrated telling folks, your children, how to do something. But it doesn't change the fact that you need to deliver that message in a kind and compassionate way. So there is some level of frustration, for sure. I think we've known for a long time things that are helpful, and it's mask, it's social distancing, it's avoid groups, it's stay home when you're sick, and hand hygiene. So everyone, I think, has that bundle of tools down and knows exactly what they are. I think to your point about testing, it's another area where there is good, solid advice that's a very smart thing to do. We have a large number of tests. We could test a significant portion of our community. We could encourage those who test positive to distance themselves, stay home, isolate, quarantine, so as not to spread that virus to others unknowingly. And we have shared that message now for a couple of weeks that this is coming, it's here, please participate. At least the initial numbers, I don't want to say they're disappointing, because it's any test is a positive movement in the right direction for us to get folks involved. But we could do more. We could test more. We could have more people involved in this process, and we could be more aggressively out in front of trying to manage this. So it is frustrating, but it is incumbent upon us as leaders in the community to keep this message in front of folks, and to continue to say what is appropriate, to communicate in a different ways so that people may hear it differently, and to keep the message out in front.
Okay, thank you. What events or gatherings are you most concerned about right now that could lead to the spread of coronavirus? Sporting events, holiday events, school, bars opening, things like that.
Dr. Lyson, would you mind speaking to that one, please?
Yeah, happily. So, any activity where you're around people unmasked and in close proximity are going to be higher risk. Any sort of activity has some risk. But again, if you're in close proximity, within 6 feet for more than 15 minutes, that would be categorized as high risk. So, a bar where perhaps you're sitting next to someone or across from someone at a small table, or at the bar, your mask is off because you're eating or drinking, certainly puts you at higher risk. And particularly these are strangers. So people outside of your core family are going to be higher risk, just because they have different contacts than you do. Dr. Griggs each week has shown us the RT number, which is hovering just a little bit above 1, which means for every person who gets the disease, they're transmitting it to one other person. And this continues. So if we can identify those activities, refrain from those activities, perhaps we can get that number down. And as we stop the spread, we can stop a lot of illness and a lot of deaths.
Okay, for Judge Felton, what makes you think now is a good time to expand bar openings?
Well, as I said in my opening statement, the governor's asked us to take those in consideration. And it looking at most of those patrons have just transferred over to more restaurant type sittings that serve alcoholic beverages. It's not really increasing the amount of people, in my thought, in going to bars, or that are included in this. But also, the bars have more restrictions than the restaurants do. They cannot go to 75. They would be at 50. There's no standing. You cannot stand along a bar. It's got to be seated. And also the serving time has to stop at 11 o'clock, where a restaurant could go, longer than that. But it puts, I think bars are put at an economic disadvantage to restaurants and that they compete against every day. So if they are agreeing to comply with the same rules, then I think we ought to let them operate.
Okay. We received this question from a citizen. I'm aware of various indoor functions and gatherings that adhere to social distancing guidelines, but once seated, most masks are removed. Is this a safe practice?
Dr. Griggs, would you mind responding to the citizen's question?
Absolutely. It's a great question. Early on in the pandemic, we really weren't clear as to whether the virus could be, we call it aerosolized, if it could be passed in very, very small microscopic droplets. Now we're aware that spread does occur in that fashion. So if you're in a room, even if you're 6 feet away from someone, and that person has the coronavirus, again, could be completely asymptomatic, 6 feet away, both unmasked. But if you're in that same space for long enough, then the virus can get aerosolized, get in those small, tiny little particles that hover in the air around you, and you can get the virus from that person. Again, even if there's six feet of space between you. Masking does seem to help with the aerosolization of the virus, the virus that ends up coming out in very small particles and then drying and then hovering in the air. A mask is really important if you're the individual who's infected. Keeps the virus from spreading outside of your body. A recent simulation, actually I think this was in Stockholm, where the Nobel Prize is awarded. It was the same university did a simulation, and they had mannequins that were ejecting small particles about the size of the droplets that carry coronavirus, and they tested different masks and saw that aerosolized particles decrease by about 50% with a mask. So it's really important because, again, no one knows if they have the virus or not, that if you're in an enclosed space that you wear that mask. It doesn't matter if you're standing, sitting, but now the larger the space that you're in, the fewer the people, the more air that's coming in from the outside, the less the risk. So if I were a deacon or on vestry or an elder of a church or a pastor of a church, I'd be thinking, okay, if I'm going to have people in an auditorium, how can I not only ensure that individuals are 6 feet away from each other, but also how can I ensure that outdoor air is getting circulated through the auditorium? I'm going to set up a big box fan at the nearest door that leads to the outside. I'm going to leave doors open so that air can traffic in and out of the auditorium. And be thinking about just overall density in that room of the individuals. So I might have 3 or 4 services in a morning and make them all a little bit shorter so that I can have 3 or 4 services. So I don't have all the same, big number of people in one auditorium at the same time. So I think Well, the individuals, all of us can be really mindful about wearing masks when we're indoors, particularly with other people that we don't know, aren't part of our household. There's also a responsibility that falls on those who are in leadership, whether it's at a church or civic events or otherwise. Really, really important that think through all the measures possible to keep this virus from spreading, not just in the big droplets within 6 feet, but also the aerosolized particles that can float in the air for minutes or even hours.
Okay, we're going to shift now and go to the media calls that we have. We have two participants from the local media on the line. We have Brooke Crum from the Waco Tribune-Herald, and we have Shaquille Amari from KWKT Fox 44. So we'll go first to Brooke. Are you on the line?
Yes, I'm here.
Go ahead, ask your first question.
I'm just wondering if we've started to get test results back from these surge testing sites.
Yes, we have, Brooke. That's a good question. I appreciate you asking. We have, I believe, tested about 2,600 people now, and we've gotten about 1,300 results back. And we seem to be getting, we've gotten them in batches a little bit. We're working on a system to get them more regularly and expect to get them back within 48 to 72 hours going forward.
Okay.
Did you have a follow-up to that, Brooke?
No, thank you.
Okay.
Good.
We'll come back to you in a minute, Brooke, with another question, so be thinking about it. How about Shaquille Amari from KWKT Fox 44? Shaquille, are you on the line?
Yes, I am. So my question was based on the bars opening. I wanted to know, you guys in favor of that? Do you think the numbers will increase here in Central Texas?
And who are you asking that to, Shaquille?
The doctor or anyone from the judge or anyone who wants to answer this question.
Okay. Well, judges already talked quite a bit about the bars, and I would like to hear from somebody on the medical team. I'll just say, you know, I think as long as the bars open in compliance with the regulations, that to me it's not that different from having our restaurants open, and the fact that they have to stop serving alcohol at 11 will help considerably. But you know, we're just going to have to wait and see what happens with them opening, and if all of the enforcement is going to be driven by complaints. So if you see a bar that is not operating in conformance with the law and the regulations and the orders that have been put out, please, you know, call the local police department or call the sheriff's office and let them know, particularly if they're operating and serving alcohol after 11 p.m. We really need to be sure that that's not happening, because that's where we can start to have some real problems, particularly with the college-age kids that are in town. Dr. Griggs, Dr. Becker, Dr. Lyson, any of you would like to speak to that?
I don't mind giving it a shot if the other two are, unless you guys want to go ahead. You know, elected officials are in a hard spot. There is a responsibility for government to protect the collective, and there's a responsibility for the government to ensure individual liberties, and there's a balancing act there. I think when you come at it as a physician, and most of what we do is care for those who are ill, we see the tragedy. There's going to be a tendency to say, let's do everything possible to protect our community from unnecessary suffering. But those like me might run the risk of pushing too hard on prevention, and might even run the risk of chipping away at individual liberties in order to achieve safety and health for the whole. So I think that there is a place for conversation. As far as this bar order goes, I'm a little concerned. I do think we have to. We're not really in a safe place as a community, and I think we're going to have to be really vigilant as a community if we do hit that inflection point where we start seeing exponential growth. You know, I think gonna feel even more strongly that maybe we should consider taking additional measures, whatever is in the governor's sort of latitude for us to make decisions as a community, or our elected officials to make decisions on our behalf. But I have tremendous respect for our elected officials, and know that they're keeping all these things in balance. And so I'm glad to be in support of Judge Felton, even while we might end up in a little bit of a different place in terms of any one of these questions. So.
Thank you, Dr. Griggs. Judge Felton, you have any closing thoughts on that?
Yeah, and I appreciate those comments, Dr. Griggs. And this is not a decision I make that I'm going to walk off from. So everything can be discussed, as I said. I'll be watching the numbers, really interested in the contact tracing information. I know it's a real tough thing to try to find out where the virus was transmitted and those kind of things. But I do understand that if I were Dr. Berner and my job was to identify the problem and try to stop the problem, I would say don't open bars. And I understand that, and I appreciate what he said about it. I'm trying to take all things in consideration. And as I talked initially, or on my opening comments, that there are consequences to everything that we do, and that we have to take those into consideration as well. But it's like we have to test things. It's the first pandemic I've been in. Most people might think I was around in 1914, but I wasn't. And I don't read that well either, so I hadn't read a lot about it. But I think that we have to look at it, see how it's going, and if it makes sense to turn around and pull that order or opt out, as they call it, we'll do that. So we'll let the numbers try to drive it, but we also have discussion points about it as well that I'm open to.
Okay, let's go back to Brooke Crum. Brooke, do you have another question for us?
Sure. There's been a few instances lately where we've gotten batches of previously unreported cases coming in. That puts some of the data into question because they're just lumped into the recovered category. And we know that there are some people who have, are considered quote unquote long haulers and are sick for quite a while. So there's a lot of conflicting information out there. How is the public supposed to have confidence in this information, or, how should they look at it and make decisions going forward?
Brooke, I'm aware of 3 different what we call data dumps, where we've gotten information that was old and stale. And in all, let's see, one of those was 78 cases, one was 105 cases, and one was 27 cases. Obviously, we don't want to have any of those, but together that's less than 200 cases out of the more than 9,000 cases that we've reported. And so I think every time we have something like that happen, we work on our systems. And when I say we, I really mean the health district. They're the ones that have to carry this load, and it is hard work keeping up with all this and trying to be as accurate as possible. These incidents haven't been caused by the health district. In most cases, they've been a result of a lab somewhere that didn't report properly, and then we find out later and have to get them reported. So I think when you think about less than 200 cases in a threshold of or a universe of over 9,000 cases in Mclennan County, it's just not enough to really make a huge difference, but we're trying very hard to avoid those issues.
Okay. Shaquille Amari, do you have another question for us?
No, I do not have another question. I think you guys answered my question in full depth.
Okay, very good. Brooke, did you have one more? We'll give you another shot since. Are you okay?
Well, just going back to what the mayor said, I mean, yes, that's 200 cases, but like Dr. Griggs said, that's 200 people who could be infecting 200 other people, and so on and so on.
Yeah, I think that's true, Brooke. And if we're not being able to do the contact tracing on them, that is a bigger impact. And I simply don't know whether that. Dr. Griggs, do you know whether the fact that those are dumped in later means that we weren't able to do contact tracing on them?
I don't know those details. I'm sorry.
We'll try to look into that further, Brooke. And I understand your concern. Obviously, we want to be able to contact trace and help people understand who they may have infected and let the people that may have been affected know as quickly as possible. So all I can say is that it is a human factor, and there are going to be some mistakes made along the way. But I think in all, we are doing very well with our health district and the work that they're doing.
Okay, very good. Well, we'll wrap that part up. We're going to now move to our closing comments. Today, we're going to just limit it to our elected officials. We're going to let Judge Scott Felton make some closing comments, and we'll let Waco Mayor Kyle Deaver wrap up. So, Judge, you got a few comments you want to give at the last here? Judge Felton, are you there? There you go.
All right. I said some real important stuff that y'all missed. But thanks for the opportunity for me to join this, especially since this order's come out and there's some explanation that should come with all these kind of things. And I think that, we're going to try to be agile as we can be with decisions that we make. I value everybody's opinion, and so I appreciate that, those opinions coming to me. The other thing is, I think that we, any operation that runs, has a lot of employees, really pay attention to the challenges that their employees are having and try to figure out ways to help them through all this thing. And was said earlier, I think we get in a COVID fog with all of this and a lot of frustration and all. And so talk about it and find people to visit about it. And you can raise hell with public officials if you want to, if that helps. So, but I think that's an important thing. And then, the only other thing is Dr. Griggs points out that I said something one time that he thought was I ought to put down as my motto is buy local and pray often. And there'll be some bumper stickers coming out for that. So
Be first in line.
Oh, that's great. Mayor Kyle Deaver. Mayor Deaver.
Thank you, Larry. Judge, thanks, and thanks for your continued leadership through this challenging time, and appreciate the fact that you had a hard decision to make yesterday, and your openness towards continuing to look at it and watch the effects. And I know that you will do that. I appreciate you. I want to thank Dr. Griggs and Dr. Becker and Dr. Lyson for being here again, and not just for being here, but for the great work that you all are all doing with your teams to help all Central Texans stay well and get well during this challenging time. Larry, thanks to you and Julie and Kelly and to all the folks that work to make this happen each week. Again, I really appreciate the press that joins us for submitting questions ahead of time and then for being here live. I think having good questions from the press is critical. Even if we sometimes don't know the answers, we will try to get the answers and get you the information that you need. Again, get your flu shot. The flu shots are widely available now. Get yours this year, even if you normally don't. It will make a difference to our community if we can keep the prevalence of flu low as we're trying to deal with the COVID virus. Please get tested. We've talked about this, so I know you're tired of me talking about it, but this is a real opportunity for us here in Waco to make a difference in our numbers and get back on a good path. We are not in a good place right now, and we need to work to get back to that. This testing can make a real difference. So go to covidwaco.com and register for a test. I have to ask you again to continue to wear your mask, wear it over your nose and mouth when you're in public. I see way too many people walking around with their masks around their chin or just covering their mouth. It's not effective unless you cover your nose and your mouth. Just do that. Let's all do that together to protect ourselves and protect each other. Try to maintain that physical distance of at least 6 feet from others when you're not in your household, and stay home when you can and avoid gathering in large groups. Please continue to take care of yourself and take care of one another. We are getting through this together. Thank you.
Well, I want to thank you all again from the medical community, first of all, and of course our elected officials. Very vital information that's being shared with our community, and thank you all for that. I want to remind our viewers and our listeners that a full Spanish replay will be at 4:30 this afternoon. And then for those people who want to see what's going on and then maybe they've been at work, we'll have it on demand. It'll replay on our cable channel today at 7 o'clock, and it's all available on demand anytime. Also want to take the opportunity to remind you it's time that you can vote. Get out and don't forget to vote, because early voting has started yesterday, and it's going to go on until the 30th. And then, of course, the election on the 3rd, very important for all of us as a community. And they're going extra and over and above to make it safe for you to vote. You can vote by mail if you want to, but certainly don't be afraid to go vote. That's the number one thing. That concludes our press conference today. We'll be back next week. Have a good afternoon.